So now to assess, to continue with the neurological assessment, that is the cranial nerve assessment. So the first cranial nerve which we are going to assess is the olfactory nerve. So to do this, which is this olfactory nerve which is going to do the recognition of how the patient is able to sense out the smell and identifying the aromatic odor. So see that you whatever stimuli you give to the patient, it should be non-irritating odor in a solid form, and it should not be in a powder form where there is high risk for aspiration. In olden days, what we did is that we were using coffee powder, tea powder, and so on. But though they are stimulant as well, if they are in the powdered form and if the patient like unknowingly inhales it, the patient can have any sort of aspiration pneumonia. So to prevent that, we can use solid soaps or toothpaste very close to the patient's mouth, and while doing this procedure, see that we'll be doing one nostril separately than the other nostril, and we'll be comparing the inference, and you have to do this with the patient's eye closed tightly, and if the patient is able to respond spontaneously, then there is the olfactory nerve is said to be intact. Now checking the optic nerve, which is the second cranial nerve. So in inspection, we will be checking for any foreign body, cataract formation, or any inflammation or injury to the eyes. And to test the physiology, we will be doing the Stellenstat test, as well as to check whether the patient is having any sort of myopia. We'll be asking presbyopia, we'll be asking the client to read the newspaper, and we'll be measuring to which level they are having the newspaper and skimming and scamming through the newspaper. To test the optic nerve, we also have the other remaining tests, such as checking the visual fields. So in visual fields, what we do is that we will be asking the patient to see to us spontaneously. Always see that one eye will be closed while examining the other eye, and we will be confronting the stimuli, that is the index finger or might be any moving object, to many of the visual field sites and see what was the inference. And we'll be assessing the fundoscope examination to know any sort of optic nerve damage or how is the optic disc as well. To assess the oculomotor, trochlear and abducens, we do all these together. So this we'll be checking for the pupillary response, whether it is equally round and reacting to light and accommodation, as well as we'll be checking for the upper eyelids for any sort of ptosis, and we check for the eyeball movement. So here we'll be asking the patient to see the stimuli wherever it is being sent, like in the fashion of X pattern or H pattern, without moving their head. Only the eyes should roll, and hereby we will be easily finding out whether the patient is having any sort of nystagmus or any sort of strabismus and so on. To assess the trigeminal nerve, so we will be assessing the strength of the masseter muscle. So first we have to palpate the masseter muscle where the patient is clenching the teeth tightly in the form of E, and then by asking the patient to open the mouth against the resistance. So you will be pressurizing by giving some resistance. With this, the patient will be trying to open the mouth wide, and if the patient is able to do so, then the trigeminal nerve is said to be intact. Again, to assess the trigeminal nerve in depth, we will ask the patient to clamp the jaws very tightly and then open the mouth tightly against the resistance. Move the jaw side to side against the resistance, and as well as making chewing movements. So here you can see the bilateral symmetrical as well when the patient is doing so. In case if there is any sort of facial palsies, that can be also picked up by using this assessment. To assess the sensation, that is the sensory inputs, you have to ask the patient to close the eyes, and then we'll be giving some sort of stimulus. First is like touch to pain, temperature and corneal reflexes. So here first the eyes are kept closed, and then you will be applying the cotton tip applicators all over the area, and if the patient is able to say it out, maybe you are giving it in the maxillary side or in the mandible side or on the forehead. If the patient says right side, left side, maxillary, mandible, then the patient is having good intact, that is sensory input is very good in the trigeminal nerve. And if the you are giving a sharp objects like in sort of a pin, then you place the object onto the patient's chin or cheeks, if the patient says it out, such as it is a sharp object, then that is said to be intact. And of course, you can use hot and cold objects, or you can use the test tube, hot water and cold water in the test tube, and then you can place it on the chin. See that you are not scalding the patient while you are doing the procedure. And to assess the corneal reflex, we will be using the tip of the wisp of cotton. Sterile cotton must be used here because high risk for infection. So see that you use the sterile cotton and use the corneal reflex test. And if the patient is immediately blinking or closing the eyes, which shows that the, and as well as patient can have lacrimation. So that is all indicating that the patient is having good sensory sensation in the trigeminal nerve. So coming to the assessment of facial nerve. So here we are going to check the patient facial movements. So to check that, we can ask the patient to raise the eyebrows, show the teeth, smile, puff out the cheeks and whistle. So here we also ask the patient to close the eyes and protrude the tongue. And then a small sort of taste substances, you can place it onto the tongue. So here also tongue you have to divide into two sides, right and left. So see that you are not mixing all the areas. So salt, so sweet, sour, all sort of essences will be placed onto the patient's tongue, and then we can do it. And after that we have to ask the patient to rinse the mouth or drink some water before testing for the other. Might be, for example, you started with the salt test. Then the patient have to drink some water, and then we have to go for the sweet test, because that should not be a bias while testing the patient's taste sensation. The next important cranial nerve what we will be assessing is the vestibulocochlear nerve. To assess this, we will be doing the whisper test, watch, tick test, rusting of fingers, that is rubbing the fingers together behind the ear. In any test, we are going to do the stroking of the tuning fork going against the mastoid process, and then we also check to the air conduction and bone conduction, and we will be asking which one is louder. Usually the air conduction is greater than the bone conduction. And in case of a Weber's test, we are going to stroke the tuning fork and place the base of the tuning fork to the center of the forehead and ask to which ear they are able to hear it louder. Normally, both the ears the patient should hear equally. And to assess the vestibulocochlear nerve, we can ask the patient to close the eyes and then walk on the feet to put the feet together and stand for a minute, at least 30 seconds. But while doing this procedure, see that the patient is not for risk for fall, because that can be high risk for head injury. So this test we call it as the Romberger's test. If the patient is able to stand well without any sort of disturbances or imbalances, then there is no impairment to the middle ear as well as the vestibular cochlear site. So the remaining will be the glossopharyngeal and the vagus nerve. So to assess the glossopharyngeal and vagus nerve, the 9th and the 10th nerve, we are asking the patient to open their mouth widely and say ah. And then we place the tongue depressor to the first third of the tongue to enhance the visualization. Then just observe the position and movement of the palate of the uvula. And if the palate should be in a normal condition, it should arise symmetrically and the uvula should be in midline. In case of any hemiplegic patients, it is not symmetrical and the uvula is not seen in the midline. To assess the vagus nerve, we will be assessing with a gag reflex. So to assess the gag reflex, what we do is that we touch the side of the pharynx with a sterile tongue depressor, and if the patient is trying to bring out something or some sort of vomiting sensation, that indicates the gag reflex is intact. And to assess the vagus nerve, we can also ask the patient to cough, or they can cough out, and if the patient is able to cough immediately, then vagus nerve is said to be intact. To assess the spinal accessory, so we will be giving resistance against the shoulders. So with the resistance, first without resistance we are assessing, then with resistance how the patient is able to elevate both the sides, as well as giving resistance to the cheek and turning the neck towards the resistance side. Might be, for example, in this picture the examiner is holding onto the left side and the patient should turn towards the left. So if still the patient is able to turn towards the left, then spinal accessory nerve is said to be intact. Push the head forwards, backwards against resistance as well. So that can be done only when there is there is no risk for any cervical fractures. And the last assessment in the cranial nerve will be hypoglossal, testing the tongue. So tongue, we are asking the patient to stick out, and we are going to give some resistance against the tongue by the external stimuli. And if the patient is still able to give pressure against external stimuli, that shows that hypoglossal is totally intact.